Good afternoon, everyone. I'm glad to see some of you back again to talk with us today. My name is Chana Gassetis. I'm the spokesperson for Boulder County Public Health. So today we're going to get a continued update on where we stand with the COVID disease in Boulder County and Colorado. We're also going to hear from our medical officer about COVID variants. We're going to hear from what we like to call our data guru, Emily Payne, who will talk to us about the vaccine data. And finally, Sheila Davis will join us. She is our equity coordinator to talk about how we are getting the vaccine to populations that have been disproportionately affected by COVID. So I am going to hand it off to Mike to give a little bit of housekeeping before we get started. Thanks.
Good afternoon, everybody. I'm Mike Stratton with Boulder County Public Health. At the end of the webinar, we will have a Q&A session. You'll see at the bottom of your screen, it says Q&As. Click that, type your question in, and we'll read that out for you. That's it. It's pretty simple. We'll get to as many questions as we can. And with that, I will turn things over to Jeff Sayak.
Hi, everyone. We appreciate you being here again today. And my name is Jeff Sayak. I'm the Executive Director of Boulder County Public Health. I'm going to go through the data quickly. And it is good news. I'm going to share my screen here. And this is the point where I want to take the time to thank everybody who's tuning in today. We have these results that I'm showing you because people are following the prevention strategies. So I really want to emphasize again the importance of this, especially as we share the information about some of the variants that we're concerned about and moving forward into these next several months. Our data does look good though. Our cases are declining. Of the 3 state indicators that place us in orange on the dial, 2 of the indicators are in green and 1 indicator is in orange. And that indicator, which is our 2-week cumulative incidence rate per 100,000, continues to come down slowly. So our data is headed in the right direction. This is the metro region. And you can see here that on the bottom, the red is Boulder County, but all of our data across the metro region had a little bit of a spike associated with Christmas and New Year's. That spike was luckily short-lived, and the data is now headed down in the correct direction. We are continuing to see new cases decreasing, so our 5-day average in Boulder County is 68. We do expect that to continue on a downward trend. And our positivity rate is at 3.2, which is great because we've been below 5% since really the middle part of December. So that means that we are doing enough testing in our community to identify and control the disease. Our hospitalizations are also decreasing, as you can see here. We are again expect that trend would continue. And finally, our deaths are declining as well, which is exactly what we would expect to see as our cases decline. There's a typical lag for 16 days in seeing our hospitalizations then start to decline, and then to see our deaths decline. So this is the exact pattern that we want to see. And again, really appreciate that everybody is taking this seriously and following those prevention strategies. And I'm going to turn it over here to Chris Urbina, but before I turn it over, I want people to know that it is extremely important. We are on a positive trend. It's looking good. We know it's been really challenging for people. It has for all of us too. We want to see our families. We want to be able to get back out and do things and socialize. But it's really important in these last few months to continue to really focus until we have more vaccine out in our community. So please do continue to follow those prevention strategies. And Chris, at this point, I'm going to turn it over to you to talk through the variants.
Thank you, Jeff. And also, I want to echo everybody, Jeff's comments and Chana and Mike's comments as well. It's great that people participate. I like to always say, we like to spread the information, not the infection. So by tuning in on this, hopefully you learn something. I always learn something. and we can share that with your friends and family members. So Jeff asked me to talk a little bit about the virus. I just wanted to let people know that all viruses mutate. So this is not unusual that we're beginning to see new variants upcoming, because as you know, the virus uses our bodies to replicate, and then it causes inflammation and causes, in this case of COVID-19, causes severe disease, as well as hospitalizations and in some cases deaths. But most of the variants are actually not severe threats. There's small changes in the nucleic acid of the virus, and that's not unusual. But as we're seeing the virus last now over a year, we're starting to see three most notable variants. And you all heard about the one from the United Kingdom, the B117. There's also a South African variant, and I won't list all those letters for you. There's also a new Brazil variant, but we also know there are other variants out there, but these are the ones that are being covered in the news most often. And I think part of it is that as we're seeing these variants start to spread and becoming dominant in our populations as the primary variant that's spreading the disease, we're learning more and more about them. The current information that some of the variants, particularly the United Kingdom variant, the B117, is known to be more contagious. That means that it can actually spread more effectively. For them, that's a good thing for the virus, but for us, it's not good. And we'll talk about some prevention strategies in a second. We also don't know whether or not the virus can cause more severe illness. And I think that's really what we're concerned about, is if it's more contagious, cause more severe illness, then we're back in trouble again. And as you can see, that Jeff talked about, that decreasing trend is a very positive trend. And I think that we can actually continue to do that if we protect ourselves against the variants. Finally, I wanted to say that our current information say that both the vaccines and current medical treatments appear to be effective against the variants. And that's good news. So that if we continue to do, and I'll talk about it in a second, if we continue to do what we think is the most effective and we all get vaccine, then we're actually going to stop the virus from mutating, and we're actually going to decrease the amount of variants in our community as well. Jeff, next slide, thanks. So as I said earlier, we're not changing our advice at the state or the CDC guidance. We'll still monitor very closely the same metrics for transmission, including hospitalizations and deaths. And Emily Payne, our data guru, is going to talk a little bit about what's happening with the vaccine, but we're still going to be watching very closely. I want to reassure the audience as well as our panelists that both in Colorado at the State Health Lab, as well as CDC, are looking very closely to look for a percentage of all the PCR tests that are taken to look to see if the variant is there. And so far, we think there's one confirmed case in Boulder County. There's 10 confirmed cases in Colorado of the UK variant, the B117 variant, but it's likely, because not everybody is being tested with the genomic sequencing, it's probably more prevalent than we think it is, just because we don't do it everybody tests. So I think, going back to what I said earlier, the same prevention strategies apply. So now we have something new, and we're going to talk about the vaccine in a few minutes, that masks, physical distancing, hand washing, disinfecting the surfaces, limited gathering, that we've been very successful so far in Boulder County, are equally as effective against the variants. And so I just want to remind people that's really what we need to focus on next. Next slide, Jeff. So I guess in summary, Jeff wanted me to make sure that you all knew that you're doing great work, that our cases, hospitalization, deaths continue to decline. We're now seeing the number of people that are potentially infectious decreasing. So now 1 in 115 people in Colorado are potentially infectious. And I think it's important to point out that even though it's often, and over 50% of our infections are likely to be asymptomatic. So you still can spread the disease even though you don't have symptoms. So it's still an important reminder to get tested. It's free, and we have lots of sites. You can go to our website to find out where you can get tested. It's free, and we encourage people to do that. So finally, I like to summarize is that, again, and I know people are getting tired of hearing this, but now that we have, and we know that each of these has been successful, it's no large social gatherings, don't mix households, Wear your mask and wash your hands, keep at least 6 feet apart, and sign up for this exposure notification app if you can. And as we get more vaccines and we can distribute out that, I know Sheila is going to talk about it in a second. As we get more vaccines, please get your vaccinations. And so I'll close there and I'll introduce our data guru, Emily Payne, who's going to talk a little bit about where we are with the vaccines. Thank you, Emily.
Thanks, Dr. Urbina. Let me just share my screen here. All right, I think everyone should be able to see my PowerPoint now. So as Dr. Urbina said, I'm here this evening to talk with you about the Boulder County COVID-19 vaccination data. We'll first talk about just some general data on how we're doing with vaccine doses, and then we'll go a little into some demographics. Before we get started though, I did want to mention the data source for immunization data. It comes from the Colorado Immunization Information System, which is a place where providers across Colorado are required to submit all vaccinations, including COVID-19 vaccinations that are administered. And this data reflects Boulder County residents, whether they receive their vaccine in Boulder County or outside of Boulder County. All right, so to start with, overall, over 22,000 residents have received at least one COVID-19 vaccine dose, which is great news. We've seen this steadily rising, and I'll show you how we're doing on a daily on the next slide. So we're at about 18,000 folks have received their first dose, and then a little over 4,500 have received a full course of the COVID-19 vaccine. We're averaging about 1,000 vaccine doses being provided per day. You can see we've risen quite a bit since the beginning when we were down only at about 200 on average. Now we're at about 948 on average per day. That's remained relatively steady over the last few weeks. And that remains partly limited due to supply, not necessarily due to ability of folks, like of our community to be able to be vaccinated. When we look at things by age, we're seeing some really great news here. So our seniors, those who are 70 plus, who are at most risk from COVID-19, we're seeing great rates of immunization there. Over 2 in 5 Boulder County residents who are 70 plus have received at least one dose of the COVID-19 vaccine. That's over 12,000 people, and that's by far the highest percentage of any age group. One thing I want to mention here is you will see some numbers among the younger age groups as well. We have to think back to the prioritization of the vaccine. Healthcare workers, those who work in hospitals, and first responders were also prioritized in the first phase. So that's why we're seeing those folks who are vaccinated along with our 70 plus population, which represents by far, again, the highest number and percentage of any group here. We've also been able to look at some of our data by race and ethnicity. So we know the race and ethnicity of about 90% of those who have been vaccinated so far in Boulder County. And right here, we're looking at 70 plus specifically because we know that a lot of the different occupational groups that were prioritized, we don't have race and ethnicity information on those groups, so we aren't able to really make a comparison. And since the vaccine hasn't been released widely to the community at this point, it isn't really a good idea to compare on an overall basis. If we look at the 70 plus year olds, however, we are starting to see a little bit of a possible disparity emerge here for our Hispanic Latinx population over 70. So that group represents about 5.3% of those over 70 who are Boulder County residents. However, they've only received about 2.5% of the COVID-19 vaccine that has been administered so far. Sheila Davis, my colleague, is going to talk after this about some of the strategies we're using to target this population and to help alleviate this disparity. We are seeing equitable distribution of the vaccine by what I say here is binary sex. So there is a limitation, and I've noted that here at the bottom of the slide, but the immunization information system is actually quite limited in what data it collects around sex and gender identity. Unfortunately, the system only has male and female as sex, and it does not necessarily reflect the gender identity that that resident may identify with. So that's a major limitation. I just want everybody to know about that. We do know the binary sex, though, for about 98% of those who've received the vaccine so far. If we look at our 70 plus population, you can see really clearly here that administration has mirrored very closely. Females represent about 57% of that 70 plus population. They received about 54% of the vaccine. and males represent about 43% of that population and who received about 45% of the vaccine. You can see over there on the right that we do have a small amount of unknown, as I mentioned, that like close to 2% unknown in our vaccination data. So that isn't a large percent, so it doesn't really isn't really a major concern here. So that's everything I have for the vaccine data today, and I'll turn it over to Sheila Davis to talk about some of our strategies.
Thank you, Emily. My name is Sheila Davis, and I coordinate the health equity work for Boulder County Public Health. And my interest in health equity started when I was a medical student many years ago. And I wanted to describe some of the sort of the health inequities we're seeing with COVID. So COVID has had a devastating impact on our community, but it is having a particularly devastating impact on the Hispanic Latinx community. So if you look at the bar graph on the very right, while 14% of Boulder County residents identify as Hispanic Latinx, they represent 36% of new COVID cases, 42% of COVID hospitalizations, and 18.5% of COVID-related deaths. Slide. Okay, and as Emily mentioned, we're beginning to see disparities in COVID vaccination rates by race and ethnicity. The data on the left describe the 70 and older population in Boulder County, segregated by race and ethnicity, and on the right, the vaccination rates, and you can see there's an underrepresentation of people of color among those who've been vaccinated. And this we attribute in part to the fact that traditional COVID vaccination strategies were really designed for the dominant culture. In other words, registering with enrolled providers, going to hospitals, clinics, and pharmacies work well for white and more affluent residents who have the means to enroll through the internet, drive to these facilities, but may not work so well for people with limited English proficiency, people with limited access to information, people with limited access to technology, people who may lack documentation, and then there are those who have a mistrust of public health and health systems because of historical injustices like the Tuskegee syphilis study, Henrietta Lacks, transphobia. So the first step is for us to begin to build or rebuild trust. And I have been speaking to community groups for the past 2 months. And I always begin with, I'd like you to join me on a sort of a risk-benefit analysis. Let's look at the risks associated with not getting the vaccine, particularly if you're a person of color, versus the risks associated with getting the vaccine because there's a lot we don't know. But there are these huge benefits because we know the efficacy is around 95%. And that's how I begin the conversation to build the trust. And our approach also includes engaging communities like we're doing now, and being transparent and being inclusive, and so that there's two-way communication. So our approach is to focus on our priority populations. These include people in rural or mountain regions, essential workers, people of color, people on the ability spectrum, people who may not have documentation, people who are unhoused. And we also have to use different strategies to meet people where they are. And these include community clinics or satellite clinics, as well as mobile clinics. You may have heard that in Denver over the past 2 weekends, There are 2 African-American churches in Denver that are partnering with UC Health, and they have launched these pop-up or community clinics. So people can just go to these churches and get vaccinated. So we're studying that playbook, and we plan to implement this here in Boulder County. So stay tuned. And then we plan to also launch mobile clinics down the road for people who may be unhoused. Okay. So I just want to conclude by saying our framework is all about creating a very broad coalition, which includes you. So I'm interested in hearing how you'd like to participate in this. We are continuing to follow the state phase distribution plan. The messaging is being coordinated through BCPH. We are leveraging our community ambassadors, and we are recruiting more community ambassadors. And we are committed to serving residents beyond municipal centers. Community members will also help us make some decisions about locations for these satellite clinics, as well as the mobile clinics. So let's do this. And I'd like to hear from you about how you'd like to participate in all of this.
Okay, thank you, Sheila. We'll see if we get some questions on that today. And now we are at our Q&A part of the session here. You'll see at the bottom of the screen, there's a little thing that says Q&A. If you'll click on that, type your question in, we'll read that out for you and get your answers. We ask that you keep your questions short and succinct so we get to as many as we can. We also ask that you keep a bit of respect. We know that all of our presenters are approaching this from a place of respect. We ask you to please do the same. And if we do not get to your question, because we're pretty much focused on vaccines and we may not have time for everything, you can send your questions to healthinfo@bouldercounty.org. So with that, let me get to our first questions. Dr. Urbina, this one will be for you, I believe. It says, hello, one of our employees has bad sinus issues, which makes it hard for her to get the regular COVID test. Is it possible? Is anyone offering a COVID test that uses saliva that's accurate? Thanks for your guidance.
Obviously, the best test, thank you for the question. Obviously, the best test is still the PCR nasal test. I understand that this person may have a sinus issue. There are some accurate tests that you can actually just do in the front of the nose, just in the interior part of your nose. So I would suggest that she get that, or he get that. There are currently no available saliva tests. There are some experimental tests that are available on certain research areas, but the saliva test is not readily available. There are some new tests that you can take home that can be done in the saliva, but just remember that they're not as accurate as the other test, the PCR test that's put into your nose. So I would suggest if you're symptomatic, if she or he is symptomatic, then try to do the anterior swab, and then as we'll see if we can put on our website, if we can, any accessibility to those new saliva tests. So keep looking at our website and see if we can come up with an answer for you.
Thank you, Dr. Urbina. All right, Chana, this one's probably for you. I followed the King Soopers link on your vaccine resource page, and it takes you to stores that in the area, but no one offers the COVID vaccine yet. You know if King Soopers will soon be doing that. Do we have information on that yet?
Thanks, Mike. At this point, my understanding is that King Soopers has not yet received any vaccine. So that's why they don't have the sign up yet on their site. We are in communication with them pretty much every day. So as soon as they have vaccine, they've told us they will update that link. So stay tuned.
All right, thank you, Chana. Jeff, this one is probably for you. So over the past week, 18 to 24-year-olds have risen in their new cases. CU affiliates are over 10% of new cases on their website, which suggest that they will once again be an issue as students return. What is Boulder County Public Health doing to try to head this off and avoid a return of September spike?
Thanks. And we are in conversations and have been with the university. We are implementing the exact same thing that we had when the university left, which is a pretty rigorous and complete system of not only communicating directly with students and parents, but also we have a partnership between the University of Colorado Police Department, the City of Boulder Police Department, and they are doing continued patrols on the Hill, which is the area where we know we had the most issues with kids who were gathering during the time that they were in school. So that is still in place. We still have the structure there. We have our folks are meeting, and we have the ability to follow up on anybody who gets cited with the university to assure that there is a accountability process in place.
Okay, thank you, Jeff. Shauna, here's one for you. It says, can you clarify who's included in the groups in phase 1B below the line, when that phase will begin, and how these people will sign up to get vaccinated?
Well, that is the million-dollar question. What we're expecting is to hear from the state later this week or early next week to specifically define who is going to be first under the line and who all that includes. My understanding is that it's actually going to include pay codes or position codes. So it's very clear who is included. To sign up to be notified, you can just go to our website, bouldercountycovid19.org. And halfway down the page, there's a sign up to be notified. And we will email you as soon as we have any information. And we welcome you to do that. Thanks.
Thank you, Jana. Emily, this one's probably for you. Do you have data on the COVID infection prevalence in the Boulder County incarcerated population? Do you have any of that data?
Yes, actually, I was just about to pull up our outbreak report that we got this week for the Boulder County Jail. I know there's a currently ongoing outbreak at the jail. I'll type that response in just so I make sure I get the number exactly correct.
Okay, thanks, Emily. I'm not sure who should get this one. I'll just throw this out there. Let's see who can answer it. When will we be able to get free or low cost rapid tests? When I called around, places were charging between $95 and $200 for them. I know that we have seen issues with the rapid test as not being very accurate. One was just actually dropped by the state of Colorado. But do we know anything about rapid tests and where people can get them at a reasonable cost?
Dr. Urbina, do you know, or Jeff?
I was going to see if Dr. Urbina would take that one.
I know they're available in many of the health providers, and then hence that's the cost issue, because the health providers charge their patients for doing these rapid tests. Unfortunately, all of the tests that are free of charge provided by the state, as well as our county, are the PCR tests. They're not rapid. But the good news is that they're readily available and they're free. And within 24 hours, you can find out if you've been 24 to 48 hours, you can find out if you're infectious or infected. So I think I know that's not a satisfying answer, but it just that those tests are not available. And part of that is because that we don't believe they're as accurate. So I think that's why we're doing the PCR tests in our free clinics.
Thank you, Dr. Urbina. Sheila, I think this is one for you. How does your office determine which parts of the population would benefit from a mobile vaccination clinic? How are you going to go about that?
Well, we have a model that we've used for Hep A vaccinations, and so we're going to use that. And I can follow up and share details of that at a later date. So that's how we're going to be, at least in the beginning, deciding how we're going to use the mobile clinic, the mobile vans, but also we're going to be looking at GIS data to look at sort of vaccine deserts. And that's another approach that we're going to be using.
Thank you, Sheila. Chana, I'll throw this one. We have a few I'm going to combine here, and maybe Jeff can answer as well. We have a number of questions about how many doses we're getting here in Boulder County. We know that we did not get as many as we wanted to this week. People are asking questions like, is this going to affect March 1st rollout for teachers? How many we're going to get this week, next week, et cetera. I know we don't have an answer, but what can we say about that?
Jeff, did you want to answer first?
Sure.
Okay.
So that is also $1 million question. We can't obviously guarantee anything at this point. We are working directly with the state and with our providers to find out how many doses we get, and the state can't always tell us how many doses we're going to get until just a few days before. And in contrast, the state doesn't hear from the federal government till a few days before sometimes. So it has been a challenge. We are continuing to meet weekly, multiple times between state and local public health agencies. I can tell you that nobody is sitting on second doses. I think what might be referenced there is the initial press conference with the governor a week or two ago, where there was 40,000 doses that weren't yet assigned. And the governor wanted to make sure that those doses were getting out and weren't sitting. But we are not sitting on any doses. I don't know of another local public health agency that's sitting on any doses. Our challenge is that we can provide up to 22,000 doses per week, but we're only getting between 800 to 3,000 doses per week. And it's really hard to count on exactly how many we get. So we're doing the best we can. As we learn new information, we will bring it here to you, so you'll hear it. And we have multiple social media channels to get that information out as well. Chana, anything I missed?
I don't think I have anything to add. Thank you, Jeff.
Thank you to both of you. Let's see. For the 1B phase, if we have volunteers that volunteer in an essential business such as food or agriculture, will they be able to get the vaccine in 1B? They are essential to our food delivery and prep. I think the answer to that is yes, but Chana, do you want to chime in on that?
The answer is we don't know. As I said before, we're just waiting for that list from the state that has more definition of who's included in each category. So we don't know yet, but most often volunteers are included if they're doing the same work, but we don't know yet. Jeff, did you have more to add to that? No, okay.
Okay, thank you, Chana. Here's a school question. I don't know if we have any school experts here, but I'll throw this out there anyway. My friend has 2 elementary school age kids going to the same school. One's in a cohort that's tested positive. The other one has not. One's being asked to quarantine, but the other one isn't. How does this work? How does quarantining work? Shouldn't the whole household be asked to quarantine? Perhaps that's one for you, Dr. Urbina.
Sure, let me give it a try. The quarantine applies to people that have been exposed to somebody that's infectious. So the child that was exposed to the child that was in the school, or a teacher or a staff member, that's the person that is required to quarantine until that person develops an infection. Then if that child that goes back to its household develops the infection, then the whole household that's been exposed to that person would also be quarantined. But at this point, only the person that was exposed to that person that was infectious is the person that's quarantined. I hope that makes sense to folks. Obviously, if you develop the infection, then anybody that you've been exposed to, including everybody in that household, would also be quarantined.
Thank you, Dr. Urbina. There's a lot of questions asking when we think we'll go to phase 2, et cetera. And I think we've heard from our experts today that we just don't know. Depends on the amount of vaccine we get, et cetera. Same thing for people who are in 65 to 69-year-old, which is also phase 2. Sheila, if you look in the Q&As, you'll see someone's asking for information on mobile vaccination clinics. So I think that's probably best for you to answer offline directly. I do have Rebecca Novinger's email if you need that. Let's see. I think we've answered almost all of these. How is Boulder County making sure we have enough vaccine available for second doses? That's the question. It all comes down to how much vaccine we get, but we are not, as we said last week, we are not going to keep people from getting second doses if there's any way possible.
Chris, Dr. Urbina, do you feel like you could answer Alex's question?
Sure, I always like Alex's question. He's a regular on our Wednesday afternoon. So Alec, thank you for continuing to ask questions. You're a curious fellow, and I appreciate that. So let's talk about antibodies. As we remember, antibodies, just like whether or not it's produced by the infection itself, or in this case, now that we have a vaccine, which also creates a antibody response in our bodies, both of those can be detected through a blood draw, so that it's likely that circulating antibodies will increase in the persons who gets vaccinated, so that if they do get a test, that they're likely to have an antibody titer that's currently, so that we'll probably see a trend in the future that antibody test will be a way of seeing whether or not we have increasing immunity. But as we've talked about in previous forums and Wednesday afternoon, it's not a perfect test. So that I'm not going to totally depend on an antibody test to decide whether or not we have enough immunity in our community. Thank you for the rhyme. But that to say that we're adequately protected. I still think we have to have maximize as many people as we can to get vaccinated, still continue the prevention strategies that both Jeff and Emily talked about, wearing our masks, physical distancing, washing our hands, disinfecting, avoiding social gatherings, and vaccinate. Then at that point, we'll have that immunity so that the virus won't have any place to go. And in fact, if we do that soon, then we'll actually decrease the amount of mutations of the virus, and we'll have less variants in our community. So all of these are important strategies. And so keep on asking your questions, Alec, and I appreciate your thoughtful response to joining us.
Thank you, Dr. Urbina. Shauna, could you talk to us a little bit about phases? We're currently in 1B, above the dotted line, hope to get to phase 2 by spring. Can you tell us the timing of that, how that works, if there's any new information on the phases?
Sure. I just wanted to take a second because I don't want anyone on the call to feel like we're not answering your questions. So the reason that we can't tell you for sure when, or even have a very good guess of when your particular priority group might be able to get vaccinated is precisely because of what Jeff talked about earlier. We don't know how quickly or how much of the vaccine we're going to get. So if you think about, for example, in Boulder County, there are about 30,000 people who are 70 years old and older. So if we're only getting 800 doses for the entire community per week, you can figure that that's going to take us, 7 weeks to get done. So what we hope to do is to tell you each week how many vaccine doses we're getting, and that can maybe hopefully give you a bit of a guide of how long it's going to take us to get to your group. I think that you can assume that if you're in regular health and you're under 65, that probably it's going to be well into the spring, unless you're, a teacher or an essential worker. And those of us who are lucky enough to be healthy and well and younger, we should wait for the spring and let folks who are at greater risk go first. So unfortunately, we just don't know for real. So we ask you to have patience as we get this going. But Jeff, do you know anything about increased doses or what's happening on the federal level?
So I haven't heard anything more than what most folks on the phone probably know, which is we are supposed to get a few more doses next week at a statewide level. I think it's projected at 80,000 versus the 60 to 70. And beyond that, we just don't know yet. Again, we're meeting multiple times with the state health department. And as we learn more information, we'll make sure we're getting it out to all of you.
Thanks, Jeff.
Let me add just one thing real quick. If we haven't told you already, we do have a website. It's boco.org/COVID vaccine, where we publish a lot of this information. We've got providers you can sign up with there, lots of information on where we are in the phases and what's going on. So I would point you in that direction. We also have we use Twitter and Facebook quite a bit. We've got a new graphic that shows how many vaccine doses have been administered. We update every Friday, so you can watch for that as well. Dr. Urbina, I think we have one for you here. If the new variants increase community spread, do you anticipate new mask directives? In other words, double masking or KN95s as opposed to basic cloth masks?
Thanks for asking that question, whoever did that. This is a very good conversation that's happening nationally. People are saying, well, if these variants are more contagious, why don't I just add extra layers of protection? And probably that is a reasonable idea. Now, I just know that if I'm wearing a N95 mask or N100 or wearing several layers of mask, I'm not going to wear that mask very long. It's very difficult to breathe. It's very uncomfortable. And so I think, and then we play with it more and we touch our hands, we don't wash our hands. So I would suggest that people wear a mask, wear it over their nose, wear it over their mouth, wash it if it gets dirty, use physical distancing, washing your hands, doing all the things that we've talked about, because that's more likely to protect you from whether or not it's a COVID-19 variant. It doesn't matter. It's not the virus particle that's actually causing the increase in transmissibility, because it's still spread the same way, coughing or sneezing or blowing it out into the air. So if you're wearing a mask properly and washing your hands and physically distancing, and everybody around you is doing the same thing, and hopefully, as we talked about with Alex's question, we increase the vaccines, then we really are going to be protected against the variants. So yes, you can wear extra masks if you want. It's uncomfortable. I think if you do all those things that we've talked about, that's going to be equally as effective. And I know there are going to be some national leaders that are going to disagree with that, but I think that that's what we should reasonably do.
Thank you, Dr. Urbina. Emily, I think we've got one for you. It starts off, data calms me. Can you report how big each priority group is and what percentage has been vaccinated so far? Do we have that information?
Thanks for that question. I totally get the data calming you thing completely, so that makes total sense. I will say that it's pretty difficult for us to get population numbers on a lot of the priority groups. That 70+ group, they're relatively easy. We have demographic data from the census that allows us to do that. But for groups like essential workers, teachers, things of that nature, we just don't have that population number at the county level to really be able to give a percent there.
Okay, thank you, Emily. All right, I think we're about out of the questions that are not duplicates of ones that are out there. I'll say one more time, if you've got a question, please type it in the Q&A thing at the bottom. We do have many people that are thanking us. It's great to see people thanking us, all the speakers, for your dedication on informing the community every week. We'd love to hear that, but if you've got any more questions, please type them in. And I
can answer about the second dose question.
Oh, can you? All right, go for it, John.
I mean, not very completely, just that we have some of the most expert immunization nurses and team, and they're very adept at making sure that we have first and second doses and that everything is timed and organized. So we are not using our second doses for first doses because we're right in step and we don't have anything extra. So you can feel good that we got it covered.
Thanks, Jana. All right, and with that, I think we'll turn it over to Jeff for to wrap us up today.
Thanks, Mike, and thanks again, everybody, for being here with us today. We'll continue to do these and share information as it becomes available. We know that vaccines are the big topic. So as we learn more information, we'll put it on our website. We'll bring it to this session, and we'll continue to share with you what we know. One of the things I want to emphasize that I'm sure you're tired of hearing from us, but it's just so important, especially with any chances that we see expansion of a variant in Colorado, is to continue to mask and social distance. The physical distancing, the masking are big things, washing your hands. It's going to help us get through these last months while we get vaccine out into the community. That's going to take some time, as we know, to get to the entire community. So if we can hang in there for those last few months, it's going to help us keep our numbers low. It's going to help us keep our kids in school. It's going to help keep our businesses open as much as we possibly can, and help us move back towards what we experienced over a year ago, which is more normalcy than where we've been in this last year. So please hang in there with us, and thank you again for all that you've done up to this point to help keep us where we are. That's all I have. Thank you.